Hi everybody, this is Sherry Edwards from Horsing Around New England, and I am going to do a demonstration today. It's a case study on laser therapy, and this is Accupoint laser therapy. Everybody's familiar with acupuncture and the tiny needles that go in specific places in the body, and these stimulate the area, open the energy, and are very helpful for all kinds of health issues, emotional issues, and an optimal level of health. So we're going to work on Twinkle today. She's a 20-year-old halflinger. She doesn't have any history of any health problems, but a couple years ago she started to develop arthritis and started to have some stifle issues. Now the stifle is the real knee of the horse. It is right up here in this area. It's the largest joint in the horse's body. And due to trauma or degeneration or arthritis, this joint can hang up and lock up on them, and you'll see a horse dragging its leg or not being able to bend it properly, and it can be quite painful for a horse to have stifle issues. So we are going to do a Accupoint therapy on her and hopefully help her with some of these stifle issues. This is a red light laser pen laser. It is 635 nanometers, and what that means is the nanometers is the wavelength. Your laser light is measured in wavelength, and the longer the wavelength, the more powerful and deeper can penetrate the tissue. And we are going to start on Twinkle. With Accupoint BL11. And what that means is BL stands for the bladder meridian. There are all kinds of little, like a network of roads through the body that are called meridians, and that's where these little points are along these meridians that we stimulate to help the animal or person and their issues. So for stifle issues, her first point that we're going to do is right above her scapula. Now the bladder meridian, it runs from the corner of the horse's eye up over the whole top line of the horse, about 2 inches parallel to the top line. Runs right down her hind leg down into the foot. And this particular Accupoint here, this is to influence the bones. It's for the betterment of the bones. It's will promote healing of the bones. It's good for any joint or bone issue. And if you notice, I've been watching my watch very carefully. When we do an Accupoint treatment, we do it for 1 minute on each point. And a treatment is never more than 15 points at a time at a session. And we do space these sessions 3 hours apart. So you wouldn't want to do more than 15 points in a 3-hour period. So that was the first point. Now the second point is BL20. And this again, it's about 2 inches or so from her top line, and it is right about here. Okay, so you'll notice we have protective eyewear on. These lasers are very safe to the skin. However, you don't want to look at them with your eye. They can cause eye damage. I wear protective glasses. Any assistant or handler, I don't have one today, would wear protective glasses. And you want to protect the eyes of the animal too. Now, working on the back end of an animal, they probably or may not need eye protection, but since I don't have a handler with me today, I put a driving headstall. It's a little big, but it's serving the purpose. Twink is turning her head, but it is blocking her eyes from where we are working on the laser. So we want to have eye protection at all times. BL20 is good for stifle pain, and the next one we're going to be going to is BL21, which is also good for stifle. This is going to be right next. So BL21 runs just about where the last rib is, and you're going to say, how in the world could you even find a rib on that pony? Well, that's one good thing about laser therapy is when the laser penetrates the tissue. A famous case study was done on this, and they found that the laser actually, the light follows the meridians. So with Accupoint therapy, if you're a tad off, you don't have to be super precise because that laser is going to follow the meridian. So that's very helpful to know that. Now we're also going to do a few points in the area that are associated with arthritis, since it seems to be, a common issue for Twinkle. So now we're going to go to Accupoint 23. Accupoint 23 is for generalized arthritis. This is for all arthritic conditions, so hopefully this will be very helpful for her. So laser therapy is something that is becoming quite popular with people and with animals. And this is just one kind of laser therapy. This is called LLLT therapy, or cold laser therapy. And what that means is it's not as high and powerful a level as compared to your lasers that are used in like a hospital that burns the tissue or cauterizes. This is very, very safe to the skin. So that's why it's called cold laser. It doesn't heat up as compared to, your ones that do heat up. And it's also called low-level laser therapy. There are other handheld lasers that we do treatments with that we apply directly to the area that needs help. It can be a wound, it can be a pulled tendon, just about any health issue we can address with laser therapy. We're going to go now to 25, which is just about at the beginning of the croup here. So the laser works on a cellular level. It promotes healing, it promotes circulation, it promotes regeneration of the cells, and it's very, very healthy. Has had excellent results in both animals and people. This area is for stifle pain that we're doing now, the 25. Now Twinkle, today we're doing 10 points. As I said, we don't want to do more than 15 in a session. Another form of laser therapy that we do is your red light therapy that also incorporates LED lights. LED laser lights are a different wavelength than these are called class 3 lasers, is what we're using. And the wavelength is different. It works on a more superficial level, but that said, it can have excellent healing results for a lot of issues. So we do use those also. We're going to 27 now, BL27. And BL27 is also for arthritis. here we're going to go down towards the back leg of the horse. There's a crease right in the back end here. You can feel where the muscle separates. This is the bicep femoris muscle up over on the side here, and you can kind of feel the crease down in here. We're going to go to BL 37. Which is right in that crease. Good for stifle pain. Now our larger handheld lasers that we apply directly to the area, we can set them for different times. A normal laser therapy treatment is like 15 to 30 minutes. You can have a continuous laser or a pulse laser, and doing that a day, couple times a day, every other day, depending on what the injury is, can be very helpful for the animal. With an Accupoint therapy, we usually do it weekly or bi-weekly if they really need it. It's just like an acupuncture treatment without the needles. Now, Accupoint 38 is a little bit further down in that crease. And we have 2 more points to go. Now, I am certified in kinesiology taping. Most people know it better as sports taping. You've seen it on athletes, you've seen it on animals. If you've ever watched the Equine Olympics, a lot of times both horse and rider use the sports tape. It's for decompression of the skin and support, has had excellent results with health issues. So I have used this on Twink and have gotten excellent results with her stifle with kinesiology taping. So we can combine the 2 treatments. Now, we would never do the taping before the laser treatment, but we do it after. So when this treatment is done, we can go ahead and I will tape this stifle area appropriately with the kinesiology tape, and with the 2 combined together, she should have excellent relief. And this is Accupoint 39. It is at the very end of the crease, where that crease is where the muscle is. Okay, we have one last Accupoint, and this is a major point. It is 40. It is adjacent to Accupoint 39. And this major point is good for all lower back, stifle, hip issues. And this is our last point. And you notice that when I do use the laser, I'm very careful to hold it perpendicular to the skin. You don't want to tilt it. You don't want to put it at an angle where the light is shining out. You want that laser wavelength, you want that light absorbed into the tissue. So you need to make sure that you place your laser appropriately on the skin. A little buggy out here today, huh? Maybe we should spray you first. so this was an example, a demonstration of our Accupoint laser therapy. And as I said, there are other forms of cold laser therapy, and I hope you enjoyed watching it. Thank you very much.